Hello dear friends, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010. Today we will talk about how can we use iron to potentially cure the cancer. And of course we will talk about ferroptosis. This is the novel mechanism of programmed cell death. We'll talk about what is that, how is it regulated, how is it activated or stopped in our body, how can we use it against cancer. I will show you different studies on some types of tumor, and we will talk about natural ways to increase ferroptosis in tumor cells. So let's get started. What is programmed cell death? Well, this is the important evolutionary mechanisms by which our body protects itself, grows, gets rid of old, damaged, non-functional and cancer cells. And we all heard about apoptosis, and many of us heard about autophagy. And they look quite different by mechanisms and how the cell dies, how it looks like. And the researchers found that there are more ways of cells to be self-killed. New mechanisms are pyroptosis, parthanatos, necroptosis and ferroptosis. Ferrum means iron. That means it's iron-dependent self-killing of the cells. Ferroptosis happens when the cell accumulates a lot of iron-dependent free radicals and they will damage the membranes of the cells. Many studies showed that ferroptosis is very important in development of many neurological diseases, degenerative diseases, inflammation, infection and even cancer. Iron is combined with hydrogen peroxide to make free radicals. Lipid peroxidation happens. What is that? This is the chain reaction when free radicals are formed and then they will oxidize, they will attack polyunsaturated fatty acids in the cell membranes. Yes, our favorite omega-3, omega-6, and this damage, when it's accumulated, will cause the cell death. And these free radicals are formed all the time. For example, when our mitochondria are working, they are producing energy, free radicals are formed. Why don't we all explode from ferroptosis? Why are we still alive? Because this chain reaction is stopped by organism compensation mechanisms, by antioxidant systems. Body has two main protectors from ferroptosis. These are glutathione and coenzyme Q10, CoQ10. And functioning of glutathione and restoration of normal health of membranes is performed by glutathione peroxidase. Very important enzyme. That means that these substances are important in prevention of many degenerative, inflammatory diseases and cancer. But the thing is, when cancer happens, it wants to survive, right? And we try to treat it with radiation therapy, with different poisons like chemotherapy. And it appears that some of these drugs and radiation therapy can cause ferroptosis. That's why cancer cells try to protect themselves. And they, can you guess, do what? They increase their glutathione to neutralize all these free radicals that we're trying to form to kill these cancer cells. How is it happening? First of all, glutathione is produced from cysteine, glutamate and glycine. To get cysteine and cysteine into their cell, inside the cell, so it can form glutathione, we need to activate this special system, the transporter, which will pump cysteine inside in exchange to glutamate. And there are some substances and drugs that can block this system, so cysteine cannot come into the cell and cannot produce glutathione, and the cell will be not protected against ferroptosis. These are, of course, arrestin. Unfortunately, it's not available for usual people. This is a study drug, But there is other drug that is called sulfasalazine, and this one is targeted drug sorafenib, for example, and also glutamate. I told you that glutamate is used to produce glutathione, but a lot of glutamate outside the cell makes this exchange pump more difficult to work, because it must pump out glutamate, but it's already a lot of glutamate there. It's against concentration. That's why it's more difficult to work. That's why they show it here that glutamate is actually against the system. Next, this is glutathione peroxidase, important enzyme to protect against ferroptosis. There are also some experimental drugs to block it, and this all depends on free iron inside the cell, concentration of iron. A lot of iron inside will start Fenton reaction and produce lipid peroxidation and produce ferroptosis. That's why, how can we target ferroptosis inside the cancer cells? We can decrease the intake of cysteine and cysteine by the usage of this stuff. Sulfasalazine, for example, is available. Other drug, targeted drug, is sorafenib, that is used, for example, in liver cancer or in kidney cancer. It can activate ferroptosis. And here they had a study on small cell lung cancer that sulfasalazine used to block the cysteine intake by the cell and production of glutathione could really decrease the growth of tumor cells, and it can be a good approach to combine with standard treatments. Next, again, we can increase iron inside the cells by using iron, by using cisplatin, the chemotherapy drug, or, by the way, by using artemisinin. Artemisia annua, I have a video on it, it's a plant, and it's also an anti-malarial drug. If you didn't see this video, please watch it. And here they say that this enzyme GPX glutathione peroxidase, that is important to protect from ferroptosis, it can protect tumor cells from chemotherapy. And many drugs like lepetinib, palbociclib, topotecan, they can be not effective until we block this enzyme. And then when we block it, the tumor becomes defenseless against ferroptosis and they start to work again. Here we see artemisinin could sensitize cancer cells by activating ferroptosis. It helps to degrade ferritin to increase levels of iron inside the cell and production of iron-dependent free radicals. By the way, aspirin has also some effect on ferroptosis, and it can improve the effectiveness of sorafenib and make the tumors more sensitive to chemotherapy and targeted therapy, to cisplatin and to sorafenib. Here they talk about head and neck cancers. This is on brain tumor glioblastoma. Also, temozolomide is another drug that is officially used by medicine. Unfortunately, these tumors are very resistant, often very resistant, or gain resistance very fast, because their glutathione in these tumor cells increase, so they are protective against ferroptosis. And if we use the ferroptosis activators, we can the tumor will regain sensitivity to this drug. Same you can see in liver cancer. By the way, if you use the drug deferoxamine, that will grab iron and remove it from the body, neutralize iron, then ferroptosis won't work, and many drugs won't work anymore. That supports our theory of ferroptosis importance in cancer treatment. Next one. Sulfasalazine can increase the effectiveness of chemotherapy in gut cancer, in colon cancer, by again activation of ferroptosis, especially if they have RAS mutation, NRAS or KRAS. And by the way, all the tumors with this mutation are more prone to be effectively treated with ferroptosis activation. For example, pancreatic cancer often has this RAS mutation, and the cases that I saw in the journals that I cannot find anymore, maybe they were deleted already, they use these integrative approaches. I was talking about the mitochondrial metabolic approach to cancer treatment, about keto diet, about all this stuff, about glutamine, and they used all these approaches plus artemisinin. That is ferroptosis activator. And to patients with stage 4, a lot of metastasis, and all the metastases were gone. That is really impressive. And here they say that sulfasalazine and artesunate may really increase the effectiveness of gemcitabine. It's a chemotherapy drug, because in general, pancreatic cancer is not sensitive to chemotherapy. Also, piperlongumine is the substance from long pepper. I'll show you the picture later. You see an enhancement of death of pancreatic cancer cells. Also sulfasalazine. Again about artesunate. This is the derivative of artemisinin from the plant. This is meta-analysis on 16 randomized clinical trials on stomach cancer, where they used other substance element, which is found in ginger, for example. They used it together with chemotherapy and showed that it increases the effectiveness of chemotherapy. Next, iron addiction. Some tumors are very addictive on iron. They need a lot of iron, more than usual cells, to grow, and we can use it because they will produce more. Of course, if they have more iron, they will produce more free radicals and will be more prone to ferroptosis, but they will protect themselves with glutathione. We need to block this glutathione, then theoretically they will all die from ferroptosis. This is a beautiful theory, but we need, of course, more clinical trials to understand what are the correct dosages, regimens, what are the markers, when to use it, etc. This is a short table on different types of substances that can activate ferroptosis by different mechanisms and cancers where it was studied. By the way, ferroptosis can help, you can see here, to improve the effectiveness of immune therapy and also radiation therapy, because ferroptosis is activated with those therapies also, and we don't want the tumor to protect themselves. It should be noted that characteristics of tumor itself will determine if ferroptosis will be effective or not. For example, some iron-rich tumors like breast cancer or liver cancer, or tumors that are rich in oxygen like lung cancer, they will be more prone to be killed by ferroptosis activation. Also, what genes are activated in this or that tumor, it's very important also. For example, we know that there are 4 subtypes of melanoma, and not in all melanoma patients immune therapy is effective. If it's not effective, the good approach may be to activate ferroptosis in those tumors, so it will be effective. So we still need to identify the markers of the tumors, which tumors we would use this ferroptosis approach in. Now we can say that most likely RAS mutations, KRAS and RAS, tumors carrying these mutations will be more sensitive to ferroptosis, like pancreatic cancer, colon cancer sometimes, and some types of lung cancer may be RAS mutated. P53 mutations, certain lung cancer or breast cancer. Triple negative breast cancer may be very prone, very sensitive to ferroptosis. Renal cell carcinoma, liver carcinoma, kidney cancer, liver cancer, many sarcomas, they also potentially may be very sensitive to ferroptosis. And still we need to understand how to activate ferroptosis in cancer cells and minimize its activation in normal cells, so we will decrease the collateral damage. Again, we already have some drugs that are available, like sulfasalazine, for example, or some natural substances contained in like curcumin or dihydroquercetin, or artemisinin artesunate, or piperlongumine, or eugenol containing cloves. The problem is we don't know exactly how much will be contained in this product, or how much will be absorbed and how much will get into tumor. Also, we don't have enough data on dosages, but as for me, this is a very important and promising approach to cancer treatment. Of course, ferroptosis activation is the complementary treatment that should be used in combination. And I hope there will be large clinical trials to show how to use it correctly and in which tumors. So for now we have what we have. And as the official oncologist, representative of official medicine, I cannot, of course, recommend you to use it. But again, I think it's very promising, especially some substances are already available for everyone. I want to thank everyone who supports our channel. If you want to join them, you can go under this video, become our sponsor, or just buy me a coffee. And I want to ask you, if you have any information, any experience on the use of ferroptosis against cancer, please share. It's very important and very interesting. It's important for me. I want to read it. I want to get more information from real clinical setting. And of course, it will be important and interesting for other people who are watching these videos. I hope it was interesting for you, and see you in the next videos. Goodbye, God bless you, and happy holidays.
Don't be afraid, doctor.